Did you know that if you can walk to your tap and turn on the water right now, you are one of the wealthiest inhabitants on this planet? And maybe you presume that everyone in Canada, a G7 country, has this same access. But this is a lie, because right here in our backyards in Canada, there are people who suffer from the lack of access to clean drinking water. Now imagine the situation in a country that is not part of the G7. Out of the 17 million people who live in New Delhi, 3 million of those are risking their lives daily by drinking water that is contaminated.
We have a solution that will save lives by providing access to clean drinking water for communities that need it the most, through the development of a water treatment system that takes unclean water and transforms it to risk-free, clean water that people can trust.
We are at Td-Nait, and with Project JAL, we are focused on solving the water security crisis facing so many people today. Along with our engineering partners in India, we draw on the expertise of business and technology to create a cheap, effective, and unique solution.
Safe drinking water is essential to human health. Are you as amazed as we are that so many people don't have access to this basic human right? As a team, we wanted to make a change. And to be most impactful, we looked at one of the largest populations on the planet. The rapidly growing population in India is putting strain on their water infrastructure, affecting impoverished communities the most. Communities get water trucked in, but even then it's unsafe to drink. Our research also found that right here in Canada, Indigenous communities are facing the same problem. Even though most Canadians enjoy reliably clean drinking water, many Indigenous communities do not. The water supplied to their often remote communities is difficult to access or even contaminated due to faulty treatment systems. In fact, people living on Indigenous reserves are 90 times more likely to be without running water than other Canadians.
The water filtration system we are developing will be low cost and easy to maintain using locally sourced materials. The design is based on tried and tested technologies, including granulated activated charcoal, ceramic filtration, and chemical purification methods. Our aim is to provide a low-cost solution to as many households as possible, improving accessibility to families and improving lives.
But we wanted to do more. In India, women often bear the responsibility of water collection, reducing their ability to provide an income to their families. To address this inequality, we plan to target women to instill entrepreneurial education, allowing them the opportunity to financially contribute to their families' and communities' future by selling and distributing the water filters in an entrepreneurial venture.
But everything isn't easy. We face difficulties bridging diverse cultural considerations in both India and Indigenous communities. To address this challenge, our asset-based community business model will be collaborative in nature, providing autonomy and empowerment to the target communities.
By partnering with an Enactus Club in New Delhi, we are working to create a sustainable filtration system and a strong business model. We have selected the Gita colony as one of the communities to initiate prototype testing of the water treatment system. The Gita colony is located outside central Delhi and is the home of approximately 76,000 people, 48% of whom are women. This will allow us to create an opportunity for women in this low-income area to foster a business which will benefit their community and increase access to clean drinking water. We will also employ local potters and entrepreneurs to produce and sell filters, creating both a financial impact and improving public health within the community. Our team's role will be to oversee the development from concept to final product to be used in homes.
Project JAL is focused on delivering safe drinking water to communities that need it the most, along with entrepreneurial opportunities and education to women that will not only save lives, but create thriving communities for years to come.